You should never hold your sneeze. While this is really rare, there was an example recently. This was a man in his 30s with a history of allergies who was driving, and he decided to hold his sneeze by covering his nose and mouth, and he developed a hole in his windpipe, also known as his trachea. He reported having severe pain in his neck, and he was rushed to the emergency room where they did a CT scan of his neck. They found a tracheal tear, and they admitted him for observation for 48 hours, and he was discharged home remarkably in stable condition without any surgical intervention. This case was reported in the medical literature recently, and most cases of tracheal perforations are either from blunt force trauma or from some iatrogenic means, meaning we did some type of surgical intervention, and this was a complication of that procedure.